Joining me on the news at 7 is the Minister of Health, Dr. Osagie Ehanire. Thank you for joining us on TVC News at 7. Now, the situation in Kano has had different perspectives. Tell us, what is the true picture? Is there any confirmation of the cause of the reported multiple deaths?
Well, there's an investigation still going on, and the investigation is being conducted by Kano State Government. But a team from the Ministry of Health arrived there on Monday and has been working with the group in Kano, trying to find where there are lines of strengths, weaknesses, and needs. The verbal autopsy on the deaths is going on, and the full report has not been given, but a partial report shows already where there are some needs.
As it is, it appears a number of states are overwhelmed with the pandemic. What has the federal government done so far in helping Kano and other states that fall within that category?
Yes, Kano is peculiar. It's a bit similar to Lagos in the sense that it's a very populated city and also areas with high population density. Those areas are particularly vulnerable when it comes to disease transmission. And that is the reason why they get special attention. Lagos has had, as you know, institutional memory from the 2014 Ebola outbreak, so they have structures in place with which they worked at that time. Kano has not had such an experience, and they are doing very well in trying with what they have, but they clearly need some support from outside, and that's why the federal government is going in there now to give support. And besides, a team from Lagos is going to be there too, and another support team of technical experts from the Viral Institute of Research in Irua. They will be going there. So going there with a combined team of technical logistic experts to assist Kano, along with ambulances that are going to be deployed in Kano.
Right. How soon do we expect this to happen?
Well, that has already started happening. And the goods, as you heard from the Secretary to the government, are already on the way to Kano. The fact-finding team is back and will be reconstituted into a technical team that will leave here in the next 1 or 2 days.
All right. Now, as at Wednesday night, Nigeria had recorded 1,728 confirmed cases of COVID-19. And it is believed that this is actually a far cry from the reality. And that's because the rate of testing in many states is still considered very poor. Honorable Minister, do you agree with this?
Well, I will say it's poor. I will say it's low compared to others. And the strategy of the Nigeria Center for Disease Control has been to do what we call smart testing. They are not testing widely, going to those areas where they expect a high yield, where there are, for example, clusters of positive cases, where they do in fact conduct house-to-house testing and watching out for those who have symptoms. The phase of looking for arrivals from overseas is slowly going to an end. But we are also tracing the contacts of those who came in from abroad, the so-called imported cases of coronavirus. So there are various strategies that are being pursued. But with the beginning of community transmission, we are definitely going to scale up the rate of testing and the isolation of patients.
All right. Now the world is desperate for a cure, at least a vaccine, to fight this pandemic. And we've seen countries around the world come up with some probable solutions. Madagascar, it's talking about some herbal mixture. And then we've heard some Nigerians say they have probable solutions as well. Is the federal government considering bringing these people together to brainstorm on finding a solution and putting the country's name on the world map?
Well, we have a Nigeria Institute for Pharmaceutical Research and Development. We also have a Department of Traditional and Complementary Medicine at the Ministry, and any application or claim that is brought to us is referred to these two bodies to work on. So anyone who has conducted research of interest and has a product that can be validated and verified, we'll be pleased to look at it and see what use it will bring.
All right, and as it is on the 4th of May, Monday, Nigeria is in lockdown and certain businesses and offices are allowed to open. With all that we know about this pandemic and the fact that there's no known cure just yet, do you consider it wise to actually ease the lockdown, or should we just continue this way?
Well, it is not an easy decision, and it was not easy for the president to make. You have on the one hand the disease, the coronavirus disease, and the health risks that go with it. On the other hand, you have the livelihoods of millions of people who's threatened or already in fact damaged. So you walk a very thin line in trying to decide which way or what you should do. And that line that the president has chosen is wise and is the best. So you allow a little bit of livelihood protection. People can return to their livelihoods and also be able to take precautions to make sure that the health benefits we have gained so far are retained and in fact reinforced so that we do not lose on the gains. That is why the non-pharmaceutical interventions are being repeatedly emphasized for the public to hear, and we are calling on community leaders and religious leaders to support us in making sure that these measures are introduced and enforced, including the mandatory wearing of masks in public places and avoidance of gatherings of more than 20 people, and washing of hands and use of sanitizers.
All right, Honorable Minister, when the lockdown was announced, the mission was to flatten the curve of infection, the curve of transmission. But as it is, it just appears it didn't help because we continually had rising number of cases. Now, what is your thought on the fact that we should rather focus on immunity, people boosting their immunity, because despite the lockdown, nothing seems to be happening?
Well, a lot has happened. The projections that we have show that we, in fact, reduced the number of fatalities we will have had by to about 60%. It will have been much worse than that if it hadn't been for those measures that were taken. So the measures have really saved quite a lot of lives. But the flattening of the curve is an aspiration. It's aspirational. And so if the curve didn't go as high as it should have gone, there's also been an achievement there. But we still hope that we can be able to get something that we can be happy with out of it.
All right. And from a public health perspective, do you think that herd immunity can actually get us where we need to be?
We know so little about the coronavirus and its behavior to be able to make any predictions. There are countries that try the herd immunity approach. Sweden, for example, is one country that wanted to experiment and go that way. So they had the fatality rates that were very starkly different from their neighbors. But the other countries who decided that they would try a different approach of waiting until the vaccine comes or being able to protect the lives of citizens one way or the other have taken a different course. So every country is actually doing what it thinks best, and every one has shut off their borders to reduce importation, and also gone in some places on lockdown and social distance. They have all applied non-pharmaceutical intervention protocol to see how much they can protect their country's livelihoods and the health of the citizens.
All right, let's talk about the isolation facilities now, the people there and security around there. There have been reports of people fleeing the isolation centers. What do you think is responsible for this, and how can we tackle it?
Well, the main reason is a non-understanding of why they are in there. There are people who actually have very mild symptoms or almost no symptoms, and they don't understand why they should be in isolation. They are in isolation because they are actually a risk to their neighbors and to their family until they clear the virus and they will be free to go. But if you have persons who do not understand that and they feel they are well, they think that you are detaining them. Some say that you are incarcerating them, which is not the case. Where the communication can be improved with patients to explain to them that it is in public interest, and it's also in their own interest because their family's interest should be the priority to them. In other cases, we should also have security. The uniform services have offered us security to be able to protect isolation centers, and we shall be making use of that offer as soon as the arrangements are made.
So considering what is on ground now, are we considering ramping up sensitization at the grassroots to ensure this does not continue?
Yes, with the entry into the community transmission phase, the National Primary Healthcare Development Agency has now come in. They work on the grassroots, they run the primary healthcare centers, they have contact with community leaders, with gatekeepers of society, and are able to ramp up sensitization, social mobilization, and drive demand for testing, and also be able to persuade more people to go for testing and also to accept isolation.
Honorable Minister of Health, Dr. Osagie Ehanire, thank you for talking to us on TVC News at 7.